Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
A full-term client is admitted for induction of labor. When admitted, her cervix is 25/0. The initial goal is cervical ripening prior to labor induction. Which drug will prepare her cervix for induction? 1. Nalbuphine. 2. Oxytocin. 3. Dinoprostone. 4. Betamethasone. The correct answer is 3. Cervical ripening, or creating a cervix that is soft, anterior, and dilated to 2 to 3 centimeters, must occur before the cervix can efface and dilate with oxytocin. Drugs that accomplish this goal include dinoprostone, misoprostol, and prostaglandin E2. Nalbuphine is a narcotic analgesic used in early labor and has no influence on the cervix. Betamethasone is a corticosteroid given to mature fetal lungs. A laboring client smiles pleasantly at the nurse when asked simple questions. The client speaks only Mandarin, and the interpreter is busy with an emergency situation. At her last vaginal examination, the client was 5 centimeters dilated, 100% effaced, and at 0 station. While working with this client, which of the following responses indicates that the client may be approaching birth? 1. The fetal monitor strip shows late decelerations. 2. The client begins to speak to her family in her native language. 3. The fetal monitor strip shows early decelerations. 4. The client's facial expressions become animated. The correct answer is 3. When the fetal head is compressed, early decelerations are seen as a vagal response occurs, and the fetal heart rate decelerates and inversely mirrors a contraction. This response commonly occurs when the client is 9 to 10 centimeters dilated or pushing. If communication cannot be facilitated, early decelerations are one indicator that birth may be approaching. Late decelerations may occur at this time, but indicate uteroplacental insufficiency rather than imminent birth. At any time during the labor process, the client may communicate with her family in her native language. The client's facial expressions may change at any point during labor and cannot be used as an indicator of imminent birth. The client with dementia states to the nurse, "I know you. You're Margaret, the girl who lives down the street from me." Which of the following responses by the nurse is most therapeutic? 1. "Miss Jones, I'm Rachel, a nurse here at the hospital." 2. "Now, Miss Jones, you know who I am." 3. "Miss Jones, I told you already I'm Rachel and I don't live down the street." 4. "I think you forgot that I'm Rachel, Miss Jones." The correct answer is 1. Because of the client's short-term memory impairment, the nurse gently corrects the client by stating her name and who she is. This approach decreases anxiety, embarrassment, and shame and maintains the client's self-esteem. Telling the client that she knows who the nurse is or that she forgot can elicit feelings of embarrassment and shame. Saying, "I told you already," sounds condescending, as if blaming the client for not remembering. The client with Alzheimer's disease may have delusions about being harmed by staff and others. When the client expresses fear of being harmed by staff, which of the following responses is most appropriate? 1. "What makes you think we want to harm you?" 2. "We like you too much to want to harm you." 3. "You are in the hospital. We are nurses trying to help you." 4. "Oh, don't be so silly. No one wants to harm you here." The correct answer is 3. The nurse needs to present reality without arguing with the delusions. Therefore, stating that the client is in the hospital and the nurses are trying to help is most appropriate. The client doesn't recognize the delusion or why it exists. Telling the client that the staff likes him too much to want to harm him is inappropriate because the client believes the delusions and doesn't know that they are false beliefs. It also restates the word harm, which may reinforce the client's delusions. Telling the client not to be silly is condescending and disparaging and therefore inappropriate. When assessing an aggressive client, which of the following behaviors warrants the nurse's prompt reporting and use of safety precautions? 1. Crying when talking about his divorce. 2. Starting a petition to delay bedtime. 3. Declining attendance at a daily group therapy session. 4. Naming another client as his adversary. The correct answer is 4. The client exhibits aggression against his perceived adversary when he names another client as his adversary. The staff will need to watch him carefully for signs of impending violent behavior that may injure others. Cry about a divorce would be appropriate, not pathologic, behavior demonstrating grief over a loss. A petition to delay bedtime would be a positive, direct action aimed at a bothersome situation. Although declining to attend group therapy needs follow-up, there may be any number of unknown reasons for this action. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client who was in a motor vehicle accident has a fractured mandible. Surgery has been performed to immobilize the injury by wiring the jaw. In the immediate postoperative phase, the nurse should 1. Prevent nausea and vomiting. 2. Maintain a patent airway. 3. Provide frequent oral hygiene. 4. Establish a way for the client to communicate. The correct answer is 2. The priority of care in the immediate postoperative phase is to maintain a patent airway. The nurse should observe the client carefully for signs of respiratory distress. If the client becomes nauseated, antiemetics should be administered to decrease the chance of vomiting with obstruction of the airway and aspiration of vomitus. Providing frequent oral hygiene and an alternative means of communication are important aspects of nursing care, but maintaining a patent airway is most important. A client with peptic ulcer disease is taking ranitidine. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Histamine, 2 receptor antagonists, such as ranitidine, reduce gastric acid secretion. Antisecretory, or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. The nurse should assess the client who is being admitted to the hospital with upper GI bleeding for which of the following? Select all that apply. 1. Dry, flush skin. 2. Decreased urine output. 3. Tachycardia. 4. Widening pulse pressure. 5. Rapid respirations. 6. Thirst. The correct answers are 2, 3, 5, and 6. The client who is experiencing upper GI bleeding is at risk for developing hypovolemic shock from blood loss. Therefore, the signs and symptoms the nurse should expect to find are those related to hypovolemia, including decreased urine output, tachycardia, rapid respirations, and thirst. The client's skin would be cool and clammy, not dry and flushed. The client would also be likely to develop hypotension, which would lead to a narrowing pulse pressure, not a widening pulse pressure. A client who is recovering from a subdural gastrectomy experiences dumping syndrome. The client asks the nurse, "When will I be able to eat 3 meals a day again like I used to?" Which of the following responses by the nurse is most appropriate? 1. Eating 6 meals a day is time-consuming, isn't it? 2. You'll have to eat 6 small meals a day for the rest of your life. 3. You will be able to tolerate 3 meals a day before you are discharged. 4. Most clients can resume their normal meal patterns in about 6 to 12 months. The correct answer is 4. The symptoms related to dumping syndrome that occur after a gastrectomy usually disappear by 6 to 12 months after surgery. Most clients can begin to resume normal meal patterns after signs of the dumping syndrome have stopped. Acknowledging that eating 6 meals a day is time-consuming does not address the client's question and makes an assumption about the client's concerns. It is not necessarily true that a 6-meal-a-day dietary pattern will be required for the rest of the client's life. Clients will not be able to eat 3 meals a day before hospital discharge. The primary care provider is able to reduce an infant's hernia and schedules the infant for a herniorrhaphy in 2 days. The mother asks the nurse why the surgery is not performed now. Which of the following responses indicates that the nurse understands a rationale for delaying the surgery? 1. Delaying the surgery ensures that your infant will receive the proper preoperative preparation. 2. We need to make sure that your infant receives nothing by mouth for at least 24 hours before the surgery. 3. Waiting these 2 days helps to allow any edema and inflammation in the area to subside. 4. Your infant needs to wear a truss for at least 24 hours before any surgery can be attempted. The correct answer is 3. If non-operative reduction is successful, delaying surgery for 2 to 3 days allows the edema and inflammation in the inguinal area to subside. Thus, the area to be operated will appear more normal, helping to decrease the risk of complications. The preoperative preparation for a herniorrhaphy is minimal and is not the reason for delaying the surgery. Typically, the infant is fed until a few hours before surgery to prevent dehydration. Trusses do not prevent incarceration, and there is no reason to use a truss preoperatively. An infant diagnosed with Hirschsprung's disease undergoes surgery with the creation of a temporary colostomy. Which of the following statements by the parent regarding the colostomy indicates the need for further teaching? 1. The colostomy is only temporary. 2. The colostomy will give time for the nerves to return to normal. 3. The colostomy may include 2 separate abdominal openings. 4. Right after the procedure, the stoma may appear purple. The correct answer is 2. The goal of the surgery is to remove the aganglionic portion of the intestine. The remaining intestines should have normal innervation. Colostomies are used to relieve the obstruction and allow the remaining intestines to return to normal size. A temporary loop or double-barreled colostomy has stomas for both the proximal and distal portion of the bowel. The final surgical repair is usually done when the infant is around 20 pounds. A new stoma is frequently swollen and bruised after surgery. The primary care provider prescribes an intravenous infusion of 5% dextrose in 0.45 normal saline to be infused at 2 milliliters per kilogram per hour in an infant who weighs 9 pounds, or 4.1 kilograms. How many milliliters per hour of the solution should the nurse infuse? Round to 1 decimal. Blank ml per hour. The correct answer is 8.2 milliliters per hour. You multiply 4.1 kilograms by 2. Since it's 2 milliliters per kilograms per hour, you get 8.2. A child is started on a soft diet after having been on clear liquids following an episode of severe gastroenteritis. When helping the mother choose foods for her child, which of the following foods would be most appropriate? 1. Muffins and eggs. 2. Bananas and rice cereal. 3. Bran cereal and a bagel. 4. Pancakes and sausage. The correct answer is 2. After clear liquids, the foods of choice are soft foods. These foods should be easily digested and low in fat. Additionally, the food should be non-bulk forming. Bananas and rice cereal are low in fat and easy to digest. Muffins and eggs, as well as sausage and pancakes, are typically high in fat and will be avoided. Although a bagel is low in fat, bran cereal is high in fiber and would be avoided because it may cause more diarrhea. A 31-year-old multigravida client at 39 weeks gestation, admitted to the hospital in active labor, is receiving intravenous lactated ringer solution and a continuous epidural anesthetic. During the first hour after administration of the anesthetic, the nurse should monitor the client for 1. Hypotension, 2. Diaphoresis, 3. Headache, 4. Tremors. The correct answer is 1. When a client receives an epidural anesthetic, sympathetic nerves are blocked along with the pain nerves, possibly resulting in vasodilation and hypotension. Other adverse effects include bladder distension, prolonged second stage of labor, nausea and vomiting, pruritus, and delayed respiratory depression for up to 24 hours after administration. Diaphoresis and tremors are not usually associated with the administration of epidural anesthesia. Headache, a common adverse effect of many drugs, also is not associated with administration of epidural anesthesia. While the nurse is caring for a multiparous client in active labor at 36 weeks gestation, the client tells a nurse, "I think my water just broke." Which of the following should the nurse do first? 1. Turn the client to the right side. 2. Assess the color, amount, and odor of the fluid. 3. Assess the fetal heart rate pattern. 4. Check the client's cervical dilation. The correct answer is 3. After spontaneous rupture of the amniotic fluid, the gushing fluid may carry the umbilical cord out of the birth canal. Sudden deceleration of the fetal heart rate commonly signifies cord compression and or prolapse of the cord, which will require immediate birth. This client is particularly at risk because the fetus is preterm and the fetal head may not be engaged. Turning the client to the right side is not a priority action. However, changing the client's position would be appropriate if variable decelerations are present. The nurse should assess the color, amount, and odor of the fluid, but this can be done once the fetal heart rate is assessed and no problems are detected. Cervical dilation should be checked, but only after the fetal heart rate pattern is assessed. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is explaining the medication options available for pain relief during labor. The nurse realizes the client needs further teaching when the client states which of the following? 1. Nalbuphine and promethazine will give relief from pain and nausea during early labor. 2. I can have an epidural as soon as I start contracting. 3. If I have a cesarean, I can have an epidural. 4. If I have an emergency cesarean, I may be put to sleep for the birth. The correct answer is 2. Typically, a client will be able to have an epidural when she is 3 to 4 centimeters dilated or the active phase of labor has been established. Waiting until the cervix is dilated to this point ensures that the client is in labor and the epidural is less likely to halt labor contractions. Nalbuphine and promethazine are used to provide relief until the client is about 7 centimeters dilated. If given after this time, narcotics may cause neonatal respiratory depression in the neonate. The majority of clients have an epidural or spinal for cesarean section. The only time general anesthesia is used is for an emergency cesarean section. The nurse is assessing an older adult for signs of dementia using the Mini-Cog Dementia Assessment Tool. The nurse gives the client 3 words to remember: cat, crackers, and toys. After having the client perform a short task, the nurse asks the client to repeat the words. The client says toys, boys, and joys. The nurse should next: 1. Ask the client to repeat the original words one more time. 2. Note on the chart that the client has echolalia. 3. Refer the client to a healthcare provider for further follow-up. 4. Repeat the test when a family member is present. The correct answer is 3. That the client is not able to recall the 3 words is a likely indicator of dementia. The nurse should make a referral for further testing. It is recommended not to repeat the test a second time if the client is not able to recall the words. Although the client repeated rhyming words, echolalia refers to repletion of the same word. It is not necessary to have a family member present when conducting the test, but the nurse should communicate the findings to the family and encourage them to seek follow-up assessment. While assessing a client diagnosed with dementia, the nurse notes that her husband is concerned about what he should do when she uses vulgar language with him. The nurse should: 1. Tell her that she is very rude. 2. Ignore the vulgarity and distract her. 3. Tell her to stop swearing immediately. 4. Say nothing and leave the room. The correct answer is 2. Vulgar language is common in clients with dementia when they are having trouble communicating about a topic. Ignoring the vulgarity and distracting her is appropriate. Telling the client she is rude or to stop swearing will have no lasting effect and may cause agitation. Just leaving the room is abandonment that the client will not understand. When helping the families of clients with Alzheimer's disease cope with vulgar behaviors, which of the following suggestions is most helpful? 1. Ignore the behaviors, but try to identify the underlying need for behaviors. 2. Give feedback on the inappropriateness of the behaviors. 3. Employ anger management strategies. 4. Administer the prescribed risperidone. The correct answer is 1. The vulgar behaviors are commonly expressions of anger or more sensual needs that can be addressed directly. Therefore, the family should be encouraged to ignore behaviors but attempt to identify their purpose. Then the purpose can be addressed, possibly leading to a decrease in the behaviors. Because of impaired cognitive function, the client is not likely to be able to process the inappropriateness of the behaviors if given feedback. Likewise, anger management strategies will be ineffective because the client would probably be unable to process the inappropriateness of the behaviors. Risperidone may decrease agitation, but it does not improve social behaviors. A nurse is planning care for an elderly client with cognitive impairment who is still living at home. Which action should the nurse identify as a priority for safety in planning care for this client? 1. Having 2 people accompany the client whenever the client is up and about. 2. Ensuring the removal of objects in the client's path that may cause him to trip. 3. Putting the client's favorite belongings in a safe place so that he will not lose them. 4. Giving the client his medications in liquid form to make certain that he swallows them. The correct answer is 2. When caring for a client with cognitive impairment, the priority is to ensure that all objects in the client's path are removed to prevent the client from falling. Additional measures, such as having 2 people accompany the client when he ambulates, placing his favorite things in safekeeping, and giving medications in a liquid form to be sure he swallows them, are less crucial and available. A client has returned from surgery during which the jaws were wired as treatment for a fractured mandible. The client is in stable condition. The nurse is instructing the unlicensed nursing personnel on how to properly position the client, which instructions about positioning would be appropriate for the nurse to give a UAP. 1. Keep the client in a sideline position with the head slightly elevated. 2. Do not reposition the client without the assistance of a registered nurse. 3. The client can assume any position that is comfortable. 4. Keep the client's head elevated on 2 pillows at all times. The correct answer is 1. Immediately after surgery, the client should be placed on the side with the head slightly elevated. This position helps facilitate removal of secretions and decreases the likelihood of aspiration should vomiting occur. A nurse does not need to be present to reposition the client, unless the client's condition warrants the presence of a nurse. Although it is important to elevate the head, there is no need to keep the client's head elevated on 2 pillows unless that position is comfortable for the client. A client with a peptic ulcer reports epigastric pain that frequently causes a client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1, 2, 3, and 4. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension, if not actively bleeding, and decreases distension and release of gastrin. Medication should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. A client with suspected gastric cancer undergoes an endoscopy of the stomach. Which of the following assessments made after procedure would indicate the development of a potential complication? 1. The client has a sore throat. 2. The client displays signs of sedation. 3. The client experiences a sudden increase in temperature. 4. The client demonstrates a lack of appetite. The correct answer is 3. The most likely complication of an endoscopic procedure is perforation. A sudden temperature spike within 1 to 2 hours after procedure is indicative of a perforation and should be reported immediately to the physician. A sore throat is to be anticipated after an endoscopy. Clients are given sedatives during the procedure, so it is expected that they will display signs of sedation after the procedure is completed. A lack of appetite could be the result of many factors, including the disease process. What should the nurse teach a client about how to avoid the dumping syndrome? Select all that apply. 1. Consume 3 regularly spaced meals per day. 2. Eat a diet with high carbohydrate foods with each meal. 3. Reduce fluids with meals but take them between meals. 4. Obtain adequate amounts of protein and fat in each meal. 5. Eat in a relaxing environment. The correct answers 3, 4, and 5. Dumping syndrome results in excessive, rapid emptying of gastric contents. The nurse should instruct a client to avoid dumping syndrome by eating small, frequent meals rather than 3 large meals, having a diet high in protein and fat and low in carbohydrates, reducing fluids with meals but taking them between meals, and relaxing when eating. The client should eat slowly and regularly and rest after meals. Preoperatively, the nurse develops a plan to prepare a 7-month-old infant psychologically for a scheduled herniorrhaphy the next day. Which of the following should the nurse expect to implement to accomplish this goal? 1. Explaining the preoperative and postoperative procedures to the mother. 2. Having the mother stay with the infant. 3. Making sure the infant's favorite toy is available. 4. Allowing the infant to play with surgical equipment. The correct answer is 2. The best way to prepare a 7-month-old infant psychologically for surgery is to have the primary caretaker stay with the child. Infants in the second 6 months of life commonly develop separation anxiety. Therefore, the priority in this case is to support the child by having the parent present. Teaching the mother what to expect may decrease her anxiety. This is important because infants sense anxiety and distress in parents, but the priority in this case is to have the parent present. Actual play and acting out life experiences are appropriate for preschool-age children. Allowing an infant to play with surgical equipment will be inappropriate and dangerous. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When teaching the mother of an infant who has received a temporary colostomy for treatment of Hirschsprung's disease about how the stoma should normally appear, which of the following descriptions about the stoma's appearance should the nurse include in the teaching? 1. Becoming dark brown in 2 months. 2. Staying deep red in color. 3. Changing to several shades of pink. 4. Turning almost purple in color. The correct answer is 2. Typically, the stoma should remain deep red in color as long as the infant has a colostomy. A dark red to purplish color may indicate impaired circulation to the stoma. A 3-year-old with dehydration has vomited 3 times in the last hour and continues to have frequent diarrhea stools. The child was admitted 2 days ago with gastroenteritis caused by rotavirus. The child weighs 22 kilograms, has a normal saline lock in his right hand, and has had 30 milliliters of urine output in the last 4 hours. Using the S-bar technique for communication, the nurse calls the primary healthcare provider with the recommendation for 1. Giving a dose of loperamide. 2. Starting a fluid bolus of normal saline. 3. Beginning an IV antibiotic. 4. Establishing a Foley catheter. The correct answer is 2. The child is dehydrated, is not able to retain oral fluids, and continues to have diarrhea. A normal saline bolus should be given followed by maintenance of IV fluids. Anti-diarrheal medications are not recommended for children and will prolong the illness. The child has gastroenteritis caused by a viral illness. IV antibiotics are not indicated for viral illnesses. Strict I&O is important in all children with gastroenteritis. A child undergoes rehydration therapy after having diarrhea and dehydration. A nurse is teaching the child's parents about dietary management. The nurse understands that the teaching plan has been successful when the parents tell the nurse that they will follow which type of diet? 1. Regular. 2. Clear liquid. 3. Full liquid. 4. Soft. The correct answer is 1. Dietary management following rehydration for diarrhea and mild dehydration would include offering the child a regular diet. Following rehydration, there is no need for the child to be on a special diet, such as a clear liquid, full liquid, or soft diet. A 30-year-old G3, P2 is being monitored internally. She is being induced with IV oxytocin because she is post-term. The nurse notes the pattern below. The client is wedged to her side while lying in bed and is approximately 6 centimeters dilated and 100% effaced. The nurse should first 1. Continue to observe the fetal monitor. 2. Anticipate rupture of the membranes. 3. Prepare for fetal oximetry. 4. Discontinue the oxytocin infusion. The correct answer is 4. The fetal monitor strip shows late decelerations. The first intervention would be to turn off the oxytocin because the medication is causing contractions. The stress caused by the contractions demonstrates that the fetus is not being perfused during the entire contraction, as shown by the late decelerations. There is no time to continue to observe in this situation. Intervention is a priority. The client is attached to an internal fetal monitor, which would be possible only if her membranes had already ruptured. If the fetus continues to experience stress, fetal oximetry may be initiated. The nurse has obtained a urine specimen from AG6. P5 client admitted to the labor unit. The woman asked to go to the bathroom and reports that she feels she has to move her bowels. Which actions would be appropriate? Select all that apply. 1. Assisting her to bathroom. 2. Applying an external fetal monitor to obtain fetal heart rate. 3. Assessing her stage of labor. 4. Asking if she had back labor pains like this with any of her other childbirth experiences. 5. Allowing her support person to take her to the bathroom to maintain privacy. 6. Checking the degree of fetal descent. The correct answers are 3 and 6. The pressure from the fetus descending into the birth canal can cause the client to feel she needs to move her bowels and could be near childbirth. Failure to assess the stage of labor and degree of fetal descent before allowing the client to go to the bathroom may lead progression of labor and could result in a birth in the bathroom. Applying a fetal monitor may reassure the nurse that the fetus is doing well. However, it does not help to determine if the fetus is ready to be born, which is a higher priority in this situation, regardless of the client's prior experience with back labor pain. The fetal head moving lower into the birth canal causes pressure in the lower back area similar to the feeling of pressure with a bowel movement. The healthcare provider has performed an amniotomy on a laboring client. Which of the following details must be included in the documentation of this procedure? Select all that apply. 1. Time of rupture. 2. Color and clarity of fluid. 3. Fetal heart rate and pattern before and after the procedure. 4. Size of amnio hook used during the procedure. 5. Odor and amount of fluid. The correct answers are 1, 2, 3, and 5. The time of rupture, color, odor, amount, and clarity of amniotic fluid, and FHR and pattern before and after procedure are all information that must be documented on the client's record. There is only one size for an amnio hook. A client has been admitted to the emergency room. The client's family tells the nurse that the client has suddenly become lethargic and is not making sense. The client has not had anything to eat or drink for the last 8 hours. The nurse further assesses the client using the confusion assessment method. The client's responses to questions are rambling, and the client is not able to focus clearly to answer the nurse's questions. Based on these findings, the nurse should report that the client has 1. Dementia, 2. Depression, 3. Delirium, 4. Dehydration. The correct answer is 3. Based on CM assessment tool, the client has an acute onset of behaviors, is inattentive, has disorganized thinking, and is lethargic, decreased level of consciousness. This cluster of behaviors constitutes delirium. Dementia has a slow onset. The client's level of consciousness is usually normal, and the client can focus attention. Clients who are depressed are alert and oriented and able to focus attention, although may be easily distracted. Further assessment is needed to determine if the client also is dehydrated. The term motor apraxia relates to a decline in motor patterns essential for complex motor tasks. However, the client with severe dementia may be able to perform which of the following actions? 1. Balance a checkbook accurately. 2. Brush the teeth when handed a toothbrush. 3. Use confabulation when telling a story. 4. Find misplaced car keys. The correct answer is 2. Highly conditioned motor skills, such as brushing teeth, may be retained by the client who has dementia and motor apraxia. Balancing a checkbook involves calculations, a complex skill that is lost with severe dementia. Confabulation is fabrication of details to fill a memory gap. This is more common when the client is aware of a memory problem, not when dementia is severe. Finding keys is a memory factor, not a motor function. The nurse determines that the son of a client with Alzheimer's disease needs further education about the disease when he makes which of the following statements? 1. I didn't realize the deterioration would be so incapacitating. 2. The Alzheimer's support group has so much good information. 3. I get tired of the same old stories, but I know it's important for Dad. 4. I woke up this morning expecting that my old dad would be back. The correct answer is 4. The statement about expecting that the old dad would be back conveys a lack of acceptance of the irreversible nature of the disease. The statement about not realizing that the deterioration would be so incapacitating is based in reality. The statement about the Alzheimer's group is based in reality and demonstrates the son's involvement with managing the disease. Stating that reminiscing is important reflects a realistic interpretation on the son's part. The nurse manager of a psychiatric unit notices that one of the nurses commonly avoids a 75-year-old client's company. Which of the following factors should the nurse manager identify as being the most likely cause of this nurse's discomfort with older clients? 1. Fears and conflicts about aging. 2. Dislike of physical contact with older people. 3. A desire to be surrounded by beauty and youth. 4. Recent experiences with her mother's elderly friends. The correct answer is 1. The most common reason for the nurse's discomfort with elderly clients is that she has not examined her own fears and conflict about aging. Until nurses resolve their fears, it is unlikely that they will feel comfortable with elderly clients. A dislike of physical contact with older people, a desire to be surrounded by beauty and youth, and recent experiences with a parent's elderly friends are possible explanations, but not common or likely. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest. A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2 and 3. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. A client has been diagnosed with adenocarcinoma of the stomach and is scheduled to undergo a subtotal gastrectomy, Billroth 2 procedure. During preoperative teaching, the nurse is reinforcing information about the surgical procedure. Which of the following explanations is most accurate? 1. The procedure will result in enlargement of the pyloric sphincter. 2. The procedure will result in anastomosis of the gastric stump to the jejunum. 3. The procedure will result in removal of the duodenum. 4. The procedure will result in repositioning of the vagus nerve. The correct answer is 2. A Billroth 2 procedure bypasses the duodenum and connects the gastric stump directly to the jejunum. The pyloric sphincter is removed, along with some of the stomach fundus. After surgery for gastric cancer, a client is scheduled to undergo radiation therapy. It will be most important for the nurse to include information about which of the following in the client's teaching plan. 1. Nutritional intake. 2. Management of alopecia. 3. Exercise and activity levels. 4. Access to community resources. The correct answer is 1. Clients who have had gastric surgery are prone to postoperative complications, such as dumping syndrome and postprandial hypoglycemia, which can affect nutritional intake. Vitamin absorption can also be an issue depending on the extent of the gastric surgery. Radiation therapy to the upper gastrointestinal area also can affect nutritional intake by causing anorexia, nausea, and esophagitis. The client would not be expected to develop alopecia. Exercise and activity levels, as well as access to community resources, are important teaching areas, but nutritional intake is a priority need. Which of the following instructions should the nurse expect to include in the discharge teaching plan for the parent of an infant who has had an inguinal herniorrhaphy? 1. Change diapers as soon as they become soiled. 2. Apply an abdominal binder. 3. Keep the incision covered with a sterile dressing. 4. Restrain the infant's hands. The correct answer is 1. Changing a diaper as soon as it becomes soiled helps prevent wound infection. The most common complication after inguinal hernia repair in an infant secondary to possible wound contamination with urine and stool. Because the surgical wound is unlikely to separate, an abdominal binder is unnecessary. The incision may or may not be covered with a dressing. If a dressing is not used, the primary care provider may apply a topical spray to protect the wound. Restraining the infant's hands is unnecessary if the diaper is applied snugly. The infant would be unable to get the hands into the diaper close to the surgical site. When teaching the parent of an infant with Hirschsprung's disease who received a temporary colostomy about the types of foods the infant will be able to eat, which of the following would the nurse recommend? 1. High-fiber diet. 2. Low-fat diet. 3. High-residue diet. 4. Regular diet. The correct answer is 4. A regular diet would be recommended for the child with a colostomy. No special diet is needed. High-fiber foods, such as fruits and vegetables, should be minimized because they increase the bulk in the stool. Fat is necessary for brain growth in the first year of life. A high-residue diet would result in bulkier stools and increased gas production, which will collect in the colostomy bag. Therefore, a high-residue diet is not indicated. Which of the following will be most appropriate for the nurse to teach the mother of a 6-month-old infant hospitalized with severe diarrhea to help her comfort her infant who is fussy? 1. Offering a pacifier. 2. Placing a mobile above the crib. 3. Sitting at crib side talking to the infant. 4. Turning the television on to cartoons. The correct answer is 1. Typically, an infant hospitalized with severe diarrhea receives fluid replacement intravenously rather than orally. Oral fluids and food are usually withheld. Although activities such as placing a mobile over the crib, speaking to the infant, or turning on the television may provide distraction for or helping calming the infant. A fussy infant receiving nothing by mouth is usually best comforted by providing a pacifier to satisfy sucking needs. When obtaining a history from the parents of a child diagnosed with diarrhea due to salmonella, the nurse should ask the parents if the child has been exposed to which of the following possible sources of infection. 1. Non-refrigerated custard. 2. A pet canary. 3. Undercooked eggs. 4. Unwashed fruit. The correct answer is 3. Diarrhea related to Salmonella bacilli is commonly spread by raw or undercooked fowl and eggs, pet turtles, and kittens. Food poisoning caused by Staphylococcus species is commonly spread by inadequately cooked or refrigerated custards, cream fillings, or mayonnaise. Psittacosis, a respiratory illness, may be spread by canaries. Contaminated, unwashed fruit is associated with typhoid fever, a disorder rarely seen in the United States. The husband of a client who was diagnosed 6 years ago with Alzheimer's disease approaches a nurse and says, "I'm so excited that my wife is starting to use donepezil for her illness." The nurse should tell the husband, 1. The medication is effective mostly in the early stages of the illness. 2. The adverse effects of the drug are numerous. 3. The client will attain a functional level of that of 6 years ago. 4. Effectiveness in the terminal phase of the illness is scientifically proven. The correct answer is 1. When compared with other similar medications, donepezil has fewer adverse effects. Donepezil is effective primarily in the early stages of the disease. The drug helps to slow the progression of the disease if started in the early stages. After the client has been diagnosed for 6 years, improvement to the level seen 6 years ago is highly unlikely. Data are not available to support the drug's effectiveness for clients in the terminal phase of the disease. The nurse, while shopping in a local department store, hears a multiparous woman say loudly, "I think the baby's coming." After asking someone to call 911, the nurse assists the client to give birth to a term neonate. While waiting for the ambulance, the nurse suggests that the mother initiate breastfeeding, primarily for which of the following reasons. 1. To begin the parental-infant bonding process. 2. To prevent neonatal hypothermia. 3. To provide glucose to the neonate. 4. To contract the mother's uterus. The correct answer is 4. After emergency birth. The nurse suggests that the mother begin breastfeeding to contract the uterus. Breastfeeding stimulates the natural production of oxytocin. In a multiparous client, uterine atony is a potential complication because of the stretching of the uterine fibers following each subsequent pregnancy. Although breastfeeding does help to begin the parental-infant bonding process, this is not the primary reason for the nurse to suggest breastfeeding. Prevention of neonatal hypothermia is accomplished by placing blankets on both the neonate and the mother. Although colostrum in breast milk provides a neonate with nutrients and immunoglobulins, the primary reason for breastfeeding is to stimulate the natural production of oxytocin to contract the uterus. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A multigravida client admitted to the labor area is scheduled for a cesarean birth under spinal anesthesia. After instructions by the anesthesiologist, the nurse determines that the client has understood the instructions when she says which of the following? 1. The medication will be administered while I am in prone position. 2. The anesthetic may cause severe headache, which is treatable. 3. My blood pressure may increase if I lie down too soon after the injection. 4. I can expect immediate anesthesia that can be reversed very easily. The correct answer is 2. Spinal anesthesia is used less commonly today because of preference for epidural block anesthesia. One of the adverse effects of spinal anesthesia is a spinal headache caused by leakage of spinal fluid from the needle insertion. This can be treated by applying a cool cloth to the forehead, keeping the client in a flat position, or using a blood patch that can clot and seal off any further leakage of fluid. Spinal anesthesia is administered with the client in a sitting position or side lying. Another adverse effect of spinal anesthesia is hypotension caused by vasodilation. General anesthesia provides immediate anesthesia, whereas the full effects of spinal anesthesia may not be felt for 20 to 30 minutes. General anesthesia can be discontinued quickly when the anesthesiologist administers oxygen instead of nitrous oxide. Epidural anesthesia may take 1 to 2 hours to wear off. A client has been diagnosed with avoidant personality disorder. He reports loneliness, but has fears about making friends. He also reports anxiety about being rejected by others. In designing a long-term treatment plan, in what order, from first to last, should the nurse include the following? 1. Teach the client anxiety management and social skills. 2. Ask the client to join one of his chosen activities with the nurse and 2 other clients. 3. Talk with the client about his self-esteem and his fears. 4. Help the client make a list of small group activities at the center he would find interesting. The correct order is 3, 1, 4, and 2. The client needs a stepwise plan for developing a social life. He needs to first work on his self-esteem and reduce his fears of rejection before talking about how to decrease his anxiety and learning new social skills. Helping him choose interesting activities is important before suggesting an activity for him. Then he will be ready to try a structured activity with the nurse present for support and role modeling. When developing the plan of care for a client diagnosed with personality disorder, the nurse plans to assist the client primarily with which of the following? 1. Specific dysfunctional behaviors. 2. Psychopharmacologic compliance. 3. Examination of developmental conflicts. 4. Manipulation of the environment. The correct answer is 1. The nurse should plan to assist the client who has a personality disorder primarily with specific dysfunctional behaviors that are distressing to the client or others. The client with personality disorder has lifelong, inflexible, and dysfunctional patterns of relating and behaving. The client commonly does not view his behavior as distressful to himself. The client becomes distressed because of others' reactions and behaviors toward him, which cause the client emotional pain and discomfort. Psychopharmacologic compliance is not a primary need because medication does not cure personality disorder. Medication is prescribed if the client has a severe symptom that interferes with functioning, such as severe anxiety or depression, or if the client has an Axis 1 disorder. Examination of developmental conflicts usually is not helpful because of the ingrained dysfunctional ways of thinking and behaving. It is more useful to help the client with changing dysfunctional behaviors. Although milieu management is a component of care, the client usually is proficient in manipulation of the environment to meet his needs. A nurse on the geropsychiatric unit receives a call from the son of a recently discharged client. He reports that his father just got a prescription for memantine to take on top of his donepezil. The son then asks, why does he have to take extra medicines? The nurse should tell the son, 1. Maybe the Aricept alone isn't improving his dementia fast enough or well enough. 2. Namenda and Aricept are commonly used together to slow the progression of dementia. 3. Namenda is more effective than Aricept. Your father will be tapered off the Aricept. 4. Aricept has a short half-life and Namenda has a long half-life. They work well together. The correct answer is 2. The 2 medicines are commonly given together. Neither medicine will improve dementia, but may slow the progression. Neither medicine is more effective than the other. They act differently in the brain. Both medicines have a half-life of 60 or more hours. When communicating with a client who is experiencing dementia and exhibiting decreased attention and increased confusion, which of the following interventions should the nurse employ as the first step? 1. Using gentle touch to convey empathy. 2. Rephrasing questions a client doesn't understand. 3. Eliminating distracting stimuli, such as turning off the television. 4. Asking the client to go for a walk while talking. The correct answer is 3. Competing and excessive stimuli lead to sensory overload and confusion. Therefore, the nurse should first eliminate any distracting stimuli. After this is accomplished, then using touch and rephrasing questions are appropriate. Going for a walk while talking has a little benefit on attention and confusion. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.